Health varies greatly, not only among individuals but also across different population groups. Think about your family, your friends, and others around you. Some people stay healthy into old age, others face chronic illness early. Why does this happen? Consider this. In 2015, a child born in one country might expect to live around 50 years, while in another country the life expectancy could be 83 years. A huge difference. Even within a single country, this gap can show up. For instance, in some places, the life expectancy of certain marginalized groups may be around a decade shorter than the national average. What drives these inequalities? A person's health is shaped by many factors: what they inherit, the choices they make, and crucially, the environment in which they live. This includes the social structures, economic conditions, access to resources, community support, and health services. These broader factors, called the social determinants of health, include things like education level, income, job or occupation, cultural background, and social class. They influence a person's opportunities, living standards, and vulnerabilities. To understand how these factors combine and influence health outcomes, a helpful approach divides them into two categories: structural determinants and intermediary determinants. Structural determinants refer to the political, economic, and social systems that shape society, governance, public policies, cultural values, and how resources are distributed. These factors influence where people stand in society, their socioeconomic position, which affects their access to good jobs, education, stable income, and fair treatment. Intermediary determinants reflect everyday material and social conditions. The quality of housing, ability to afford nutritious food and other essentials, working conditions, stress levels, relationships, and psychological well-being. Also included are healthcare systems, how accessible they are, how good the services are, social cohesion and social capital, and how connected people are, how much support they give one another, act as a bridge between structural and intermediary determinants. All of these elements interact, often in complex, non-linear ways. For example, limited income and education can lead to poor health, but sometimes poor health can itself restrict a person's ability to get a good job or continue education. Large-scale health problems can even reshape social and economic structures in a region. Addressing these social determinants of health is challenging. It means improving structural and intermediary conditions through policies, community support, equal access to education and healthcare, and it requires coordinated efforts across society, local communities, national governments, and international organizations. By understanding and acting on these underlying factors, not just treating illness but changing the social conditions that lead to inequality, we can move toward better health for everyone.